I'm so happy to present Vivace today from Aesthetics Biomedical and tell you my experience with this great machine. We've had it since December 2017, and myself and my other providers just love it. So today we're going to be going through some slides explaining how we use the machine and what we use it in combination with. I'm a board certified dermatologist. I've been practicing for 30 years, I hate to say. I specialize now in aesthetic medicine. I still do a few Mohs cases on my old time patients. I have a practice in Fresno with 45 staff members and multiple providers. I have 3 nurses, 4 nurses, 3.5 nurses, and we love Vivace, and I'm going to tell you about it, why we love it today. So Aesthetics Biomedical is the company, and they really help promote Vivace, and it's one of the top microneedling with radiofrequency devices that we have, although we have a couple different ones in the office. One reason they're so great, they have great groundbreaking technology. Today we're going to talk about the Vivace, but they also have skincare, plasma technology, and hair removal. So they have a great scientific advisory board, and these are members that you all know many of the names on here to help us develop the best treatment for our patients. And these are great thought leaders that we have to work with. We also have a great clinical advisory board that is actually, you know, both of the groups are doing patients and treating studies, but actually that's why we learn, and communication is key. So it's great that Aesthetics Biomedical has put these board members together so that we can share knowledge and explain to each other what we're finding most successful usage, because we're always improving. Over the 30 years, you never stop learning. And so that's what we're going to help you with today. And I'm happy to be one of the ambassadors to tell you about my experience with the Vivace and my office experience, and why we love it so much and why we think it's only going to grow with what we use it for. So this is important. Aesthetics is growing. You know, now that we've come out of the pandemic, you know, our phones are going off the hook because people are just ready to come out. And one of the most fastest growing areas is microneedling, and microneedling with radiofrequency. And why is that? It is, you know, a great treatment, not only because we can use it on multiple skin types, we can use it all year long. So it's a great treatment, because with the laser center, we used to have to not do as many treatments in the summer because many of them in Fresno, it's very sunny and we could have to postpone some of the treatments till the fall. But we continue to use microneedling with radiofrequency all year long. We also are expanding. I think one of the biggest areas we're expanding, and we're going to continue to expand in the next few years, is on body treatments. And the great thing about Vivace is you can use use it all over the body. So you can use it, you know, everywhere on the skin, and that's great because a lot of lasers you can't. The other thing is with this microneedling, you're creating a channel, and we're just finding out all the wonderful different things that you can, although you have to be careful, that you can use to help promote collagen formation and even lighten the skin. So we're going to talk about that. So microneedling has really taken off, and I think it's only going to continue to grow because of those factors. With Vivace, it's really a dramatic results with very little pain and no downtime. So you can adjust it to multiple different levels. And you know, I will go over later some of the levels we use it at. Usually it's just with some topical numbing medicine, although we have nitrous oxide that we can use if we want to go at a very much higher level. You can use a robotic arm we have, and it's just very easy for the provider to use and very easy for the patient. Has these wonderful 36 needles, and the needles of the machines are very important because they'll show you that sometimes they don't pierce or penetrate evenly, but with the Vivace, we get a great penetration to the depth that we want to promote. And we can do different depths to get this different settings and get the best results on our patients. We use different things. So we use the soothing mask afterwards and also sometimes the boost serum. But the great thing about microneedling, like I said, is you create these channels that you can use multiple different products. So you're going to use different antioxidants like the boost serum. You're going to use some different soothing products, but you can also use, we're using tranexamic acid now for melasma, and we are using Sculptra to help boost collagen production. So we're going to go over more of that in detail. And this is a patient. We use Vivace, and what we tell patients Vivace is for is to help stimulate the production of collagen. So our patients, it's important to tell even those patients that are, you know, in their 20s, that that's when the fibroblasts start to show down and slow down collagen production. So we're slowing down collagen production, our pore size is getting larger, we're starting to form wrinkles. So we use it for treatment and also for prevention. So what we're doing is we're creating a micro injury with the microneedling, and that is boosting the fibroblasts to produce more collagen and elastin, which is making the wrinkles, the pore size, the texture all improved with that. The radio frequency is an added boost to give a little bit of heat to help stimulate more collagen and to stimulate some contraction of the skin. So that's what's been so fantastic with the microneedling with the radio frequency, and Vivace has been fantastic with that. Post-care regimes, you can use CE ferulic, which is great. It helps antioxidants, it helps calm the skin, and then we also send them home often with a mask. In the office, like I said, in our office, we're applying more different things. Sometimes we use PRP, which is growth factors. Often we will use Sculptra, which has shown in those channels, and those channels stay open for about 6 hours, so you can get absorption of those products, and stimulation of collagen is increased when you add the Sculptra. We also now are using tranexamic acid, which we only used to use orally, but now we can use it topically for melasma, because melasma is one of our most difficult things that we treat. And really we have to explain to the patients that it's maintaining the melasma and improving the melasma, and it's going to be a persistent treatment over the years. So now during the summer, we may do Vivace and add the tranexamic acid, and then we can have them on hydroquinone another part of the year. And then because we really have to rotate what we do, and here in Fresno, again, where we have so much sun, we're just excited that we're going to be able to use this more with Vivace. So we use multiple different things with the Vivace, and I think there's more that are going to become available. You do have to be a little bit careful to use what has been studied a little bit, because you can get some granulomas and other things. We haven't seen them with anything that we use, but again, there will be more things that you can use on the skin and that can cause different improvement and give us a different boost of either decreasing pigment, increasing collagen, and many different things. So this is a study because with this Vivace, you have both 1 millihertz and 2 millihertz. And we use mostly 1 millihertz. And this is a study, and we're going to go through some of the slides, and I'm going to show you why with that. But you do have the availability to use both. We might use a 2 millihertz in a younger patient just for a little bit of collagen boosting, but the 1 millihertz is going to give us a wider zone of coagulation. And also you can stack this and to give a better result. So this paper, and we're going to go through the studies that show us why we're using the 1 millihertz, and then we'll go over in the end what are specific settings that we may be using in the office. So this is a nice histological slide of the 1 millihertz insulated needle, which is really all that we're using now at different power levels 4 through 8. And this is showing you that you get a fairly, at the lower level, circular area of coagulation of the tissue. And most of the time, my nurses are using it at a level 4 and 5. So that is A and B that we're using, but this is only a 2 millimeter depth. So they're going to use the 4 and 5 level at multiple different depths. So you're going to get multiple levels of coagulation, but the widest level with the 1 millihertz with this. So we're probably using, anywhere from 300 to 500 milliseconds with a level 4 to 5. And this is comparing with the 2 millihertz, which again, we may use in a younger patient. And this is an insulated needle, which is really what we use now. But this is showing you at the different levels 4 through 6, how the coagulation is a much deeper, narrower tract through the skin. So we really want to get more improvement when we use the 1 millihertz because it's a wider level of coagulation. And then we can stack those at different levels so we get that wider level at multiple levels. And again, with the coagulation, this is comparing the insulated versus the non-insulated needles. So we're using now the insulated needles, which shows you that you get an area of coagulation very similar. The only one that's slightly lower is at the highest level that often we don't use. You can even be shown with this if you go, at a higher level, at a deeper area, you can almost get down to the fat, which we may want to get under the chin, but often we don't want to get that in other areas of the face because we don't want to decrease the fat. So again, the great thing about this machine is you can adjust it to many different levels, to many different energies to concentrate on treating exactly what you want to treat. Again, so the 1 millihertz insulated needle is the largest area of coagulation. And this, what else is shown is this thermal dispersion happens all the way up to 10 milliseconds. So we usually use about a 300 to 500 milliseconds, but the dispersion of the heat is going way beyond that. And it's a uniform area of heat. And then we actually stack them at multiple levels. So you may start at 3 millimeters depth, go to 2.5, or go even less to see, depending on whether you're treating scars, whether you're trying to treat superficial lines, whether you're trying to make a whole channel so you can introduce some topical agent with it. So again, you can make this unique for each patient and adjust it. And this is just showing you that with the 1 millihertz on the right, you have a wider area of coagulation. And this is at the highest level of the power 8 and the 600 millisecond and the 2 millimeter depth. Thank you, Dr. Tangeti. And this is just, you know, a picture of the needles and the handpiece, which is very easy for my providers, my nurses, my nurse practitioners and PAs to use. And we have our beautiful machine. And we, you know, actually have 2 of these. So we started off in 2017 and did so well with it that we needed a second one. It has been a New Beauty Award winner in 2021. You know, 2020 doesn't really count. So I will go over, you know, how many treatments we've done and different things in the end. But this has been a great treatment. It's really a brand name, kind of like we have other agents that are brand names in our office. Again, we can treat all skin types and we can treat all body areas, which is so important because so many people come in for stria on the abdomen, for crepey skin on the arms. So we're using it in these areas. Sometimes we're combining it with other treatments because we're really doing a lot of other body treatments. So we're doing Quo for cellulite, we're doing M-Sculpt, we're doing the Sculptra, we're doing dilute radius, and then we want to tighten and smooth the skin on the body. And Vivace is a great treatment that we can do for that. And the average treatment is usually 4 to 6 treatments, although on the body you can even do more than that. It's the most requested microneedling and radio frequency on Real Self. So again, name brand is great. People are calling for it. People recognize it. And my nurses and providers love to do the treatments. Again, it's a top trend, and I feel like it's only growing because there's so many things that we're studying with this about what we're adding to the skin, different body areas we can do. And I really feel, you know, in dermatology, we were first treating the face and neck, and now we're treating more and more cosmetically with all the skin over the whole body. And, you know, it's great that this is a treatment that we can use over there. It's, you know, the #1 contacts that you're going to get for your office, and you know, it's the #1 selected out of 7 different treatments, and we really love this treatment, and we have a couple different ones in our office. It has 3 more times than any other microneedling and radiofrequency reviews, any competitor, and it has no downtime or very little downtime. They may leave the office red, but then we put sunscreen on to make sure they can go out and look normal, but really very little downtime, and they can just come in for the treatments. They can come in the summertime. So I'm sure this is May and June we'll start to run a special because we won't be doing as many IPLs or Frapsels or other lasers that we'll have to wait till the fall. And these are some examples of the before and afters after the 3 treatments 4 weeks apart. And you can see a nice improvement of the crow's feet on this patient. And, you know, it's really dramatic. Usually people start noticing about 2 weeks after the treatment an improvement in the skin. Again, this is a patient on the cheek. You can see that there's just an increased glow to the skin as well as a decrease in some of the finer lines. And again, this is after only 3 treatments 4 weeks apart. This patient, I mean, you would continue using patients. And if she doesn't want to do a more aggressive treatment, you're going to continue, you know, getting improvement with the Vivace. But with really only 3 treatments, you see quite remarkable improvement of the fine lines and just the glow of the skin. And again, you can see here, it helps, you know, tighten the skin. And so that's what makes it different than the regular microneedling. You can see in the marionette area of tightening of the skin, and that is with the radiofrequency adds benefit to that. And so we use it in combination, you know, with other things that we do. This is affecting the surface to tighten that. We also can use it with all therapy. We use it with dilute radius, with Sculptra, because I feel anything that you're boosting the collagen production, sometimes if you use both things together, you're going to get an increased impact over using just each one separately. And this is showing you for acne scarring, how it's helping and give a better texture and again, a better glow to the skin. With this, I might combine it with subcision or with fillers afterwards, but you're really trying to stimulate that collagen production in those acne scars and boost them up, which you can see that it helps those patients and helps with the redness in this patient. And again, with acne scars, it's improving her redness. after 3 treatments 4 weeks apart. So we use it, like I said, for pore size, for acne scars, for redness, and just for texture, for fine lines and wrinkles with very little downtime all year long. And these are some stars, and so it's, you know, really popular on, on Instagram and social media, and, you know, they're posting how easy their treatment is, how happy they are. And so we always, you know, this is very important to all our practices now, because this is the future. And so we're very happy to see that our patients are happy with this treatment. Again, it's really popular in all the different magazines and all the different social media and all the different ads. So, you know, people are really asking for it. We are, you know, really very happy with it in the office and promoting it now with different topical medications that we can use with it. And we will continue to promote it off the face, on the body areas, and with newer combinations as we learn what we can use. So really, to experience Vivace, you have to experience and see the results. And so we tell the patients, usually it's about 3 to 6 treatments that we do 3 to 4 weeks apart. And our patients just love the results. We are doing a lot of treatments in our office. We had a question in 2019, we did 500 treatments. So that brought in over $500,000 into the revenue, into the practice, and we needed a second machine at that time. And I'd like to thank the Aesthetics Biomedical again for putting together a great group of professionals to help share all our scientific knowledge and to help share any innovations that we have, because really that's going to make the treatment better for all of us and for our patients, which is why we're all here. Okay, perfect. Perfect. So we have some questions. You know, we can use Vivace on all skin types and even in the summertime. And, you know, you want to make sure that you have an insulated needle and that you might be going to a slightly deeper depth because you don't want to affect the pigment in those patients. We've done, another question is, how many treatments have we done? I'd say at this point, we've done now over 1,000 treatments. 2020 was a little low, but we've done over 1,000 treatments. And we do use, they asked if we did Vivace for a cellulite or stretch marks. So often we'll combine it with other treatments. Stretch marks are a scar. So I do think microneedling and radio frequency helps new growth of skin through those scars and the stretch marks to help normalize the appearance of the stretch mark and decrease the appearance of the scars. With cellulite, we are using it also. We're using it in combination with Selfina and Quo, which decrease the dimples. And then we use the Vivace to tighten the skin, because cellulite is a multifactorial problem with laxity, dimples, and so we have to often use multiple modalities to give the patient their best results. So for cellulite, you know, we may be using Emsculpt to build the butt muscle. We may be doing Quo or Selfina to decrease the dimples, and then we're using Vivace to tighten and smooth the skin, along with dilute radius to stimulate collagen, and also maybe all therapy to help to do a little bit of lifting also. Let's see, another question. Often my nurses are saying, you know, their most common treatment parameters are about a 4, you know, with a 300 to 400 millisecond. The longer you have, the more heat dispersion you're going to have with the time. So that's what they use on most patients. Although, like I said, depending on what you're treating, whether you're treating acne scarring or that may be variable. So again, I wanted to thank Aesthetics Biomedical for putting this together and helping us share our knowledge, and then let you know that you can get in touch with them, and if you have any further questions for me. Thank you.